Hi, everybody. Good morning and welcome to Today. We are glad you are with us this morning, and we can show you right away this is not a normal morning as we, right here on this show, try to practice what our experts are preaching, a little social distance, not emotional distance, but physical distance to do our part.
It does matter. We're practicing that at home. We're practicing that with our children, and we want to practice that at work because we feel like it's important. We have so many developments to talk to you about overnight, including that stunning recommendation. The CDC now advising all events with 50 or more people, we're talking things like weddings and everything in between, be canceled for the next 8 weeks.
It's a stunning guideline, and it comes as the nation's largest cities and many others, including New York and Los Angeles, announce strict new restrictions. Bars and movie theaters set to be closed in many places. Restaurants open, but just for takeout or delivery only.
Meantime, New York has also joined the lengthy list of cities closing down schools. The largest district in the country now shuttered until at least April 20th and possibly beyond.
And in a bold move to try and address the economic impact of this pandemic, the Federal Reserve has slashed interest rates to near zero. We've got complete coverage. We're going to begin with this massive meltdown at key international airports as Americans in Europe have rushed to return home. NBC's Tom Costello is on this fast-developing story. Tom, good morning.
Good morning. We have moved to a portion of the airport here that is less crowded, fewer ticket counters, but I'll tell you, there's really nobody in this airport, and the parking garage is virtually empty. As you know, the president ordered enhanced screening for anybody coming back from Europe, funneling them through 13 airports, and then if they have a positive health screening test, they need to self-quarantine for up to 14 days. But with Americans desperate to get out of the hot zones right now for this virus, in fact, they were simply overloaded at health screening centers at airports, 40,000 on Saturday alone. Late Sunday night, an unprecedented recommendation from the CDC. All in-person events of 50 or more people should be canceled for the next 8 weeks. The news comes amid chaos and gridlock at airport customs checkpoints. From Dallas to New York to Chicago O'Hare, thousands upon thousands of travelers returning from Europe forced to stand shoulder to shoulder over the weekend for 4, 6, even 8 hours waiting to get through customs and newly required health screenings. Exactly the kind of massive crowds the nation's health experts are trying to avoid.
I felt unsafe and more at risk of getting the coronavirus.
3 hours to get through customs. It took another 2 hours to get through the health check.
Chicago's mayor calling on the federal government to surge extra personnel to the airport checkpoints.
Not only are you creating a disaster, not only are you creating a hazardous circumstance that threatens the public, you risk causing serious illness and death.
The acting Homeland Security chief says they're moving fast to ease the backup.
The lines, again, that we saw overnight at a limited number of airports, including Chicago, are unacceptable.
The administration insists Americans who are still overseas don't need to rush home. They won't be locked out. The National Security Council fighting back against misinformation on social media. Tweeting overnight, text message rumors of a national quarantine are fake. There is no national lockdown. President Trump addressed the seriousness on Sunday.
There's a very contagious virus. It's incredible, but it's something that we have tremendous control of.
Those comments coming just hours after the nation's top expert who appeared with the president at that briefing was on Meet the Press.
Americans should be prepared that they're going to have to hunker down significantly more than we as a country are doing.
This morning, drastic measures are underway across the country. New York Governor Cuomo is calling on the president to deploy the Army Corps of Engineers to set up temporary medical centers.
Let's use that massive logistical machine of the military to actually save lives.
Another dramatic move by the Federal Reserve, cutting the benchmark interest rate to near zero, hoping to stem the economic fallout. Meanwhile, as some states set up drive-through testing, the White House says 2,000 labs should have high-speed test kits by today, able to process nearly 2 million tests over the week. Back here at the airport, the White House tells us that they had improvement on Sunday from those chaos checkpoint, gridlock checkpoint situations. They say that they saw improvement at some airports, but we're hearing reports of 2 and 3 hour waits. Also, now the airline situation is becoming really critical. United Airlines has now announced that it is cutting 50% of its flights. It is also announcing it is working with unions to talk about cutting pay. In fact, the CEO 100% pay cut already, and some officers a 50% pay cut. The situation, they say, more dire than 9/11, and United is not alone. The other airlines are in the same boat here. They're desperate for a government emergency bailout of some fashion. Guys, to underscore this, the airlines are really the linchpin, or a linchpin, for the entire economy. They allow business to connect. They allow commerce. And right now, their very survival is very much in jeopardy. Guys, back to you.
This is going to be a huge matter of discussion and action, perhaps, Tom, in the coming days. Thank you for leading us off. We appreciate it.
Now we're going to move to the major cancellations happening from coast to coast on the heels of those dramatic new CDC guidelines. Cities across the country shutting down schools and businesses. NBC national correspondent Miguel Almaguer has that part of the story. Hey, Miguel, good morning.
Hoda, good morning. The nation's two largest school districts, including here in Los Angeles, are shut down. Governors in multiple states are ordering that restaurants, gyms, and crowd sizes be restricted. Drastic and dramatic moves to help reduce the spread of the coronavirus.
This morning, the nation's largest school system, New York City, has made the difficult decision to keep more than 1 million students and staff at home until at least the 20th of April.
We may not have the opportunity to reopen them in this full school year.
Mayor Bill de Blasio says he'll sign an executive order closing all New York City nightclubs, movies, theaters, and concerts, and restricting restaurants and cafes to takeout or delivery only starting tomorrow. The mayor of Los Angeles announcing similar closures, including gyms. At bars and restaurants nationwide, an early last call. State and local officials in Illinois, Ohio, and elsewhere closing nightlife until the end of the month.
The time for action is here. This is not a joke. No one is immune to this.
California's governor also taking unprecedented action, urging the state's 5.3 million senior citizens to self-isolate.
We are doing so with our eyes wide open at the magnitude of what that means.
The new restrictions follow a weekend in which some Americans ignored calls for social distancing. Bars in Chicago, New Orleans, and Savannah, Georgia, packed with St. Patrick's Day revelers. Spring break crowds over the weekend in Miami and Fort Lauderdale, prompting city leaders to close beaches.
We cannot become a petri dish for a very dangerous virus.
More than 40,000 residents in Teaneck, New Jersey, ordered to self-quarantine after a growing number of cases there. Meanwhile, a growing list of retailers have temporarily shuttered.
Hi, folks. We're actually closed until the 27th.
Including Apple stores, Nike, and Urban Outfitters. For at least the next 2 weeks, Starbucks coffee will only be available to go. The Seattle-based chain also closing stores in high social gathering locations. But the biggest blow may come to small businesses, like Manhattan's century-old Town Shop, closing indefinitely.
These are strange and unsettling times, but I feel for the health and well-being of my staff and my customers, it's the right move for now.
Hard choices during an unprecedented national fight to slow the spread of the virus.
The restrictions on crowd sizes have even reached the Strip of Las Vegas. MGM Resorts, which operates multiple casinos, about a dozen on the Vegas Strip, says they will shut down hotel and casino operations. A major announcement, Hoda, as this spreads all across the country.
Yeah, Miguel, thank you so much. We're hearing there may even be tighter restrictions coming when the vice president speaks a little later today.
We'll see what happens. Yeah. For the moment, let's turn to NBC News medical correspondent Dr. John Torres and NBC contributor Dr. Joseph Fair, who is a virologist. He was on the front lines of the Ebola outbreak. Doctors, good morning. We are so grateful for your expertise. Do want to say thank you. Dr. Fair, when you hear the CDC's guidelines, they just came out, no gatherings over 50 people. Does that seem sufficient to you, knowing what you know about epidemics and outbreaks?
Not in the least. I mean, Ebola is far less contagious than coronavirus, and we would recommend that there are no gatherings, period, if we're actually implementing social distancing. So by nature, if you have 50 people, that's 50 people where half of them or more, you don't know where they've been You don't know if they're sick or not. You don't know if they're asymptomatic yet.
How many people is the right number of people that you should be able to be around?
Your immediate circle only.
Yeah.
And you know where they've been and they know where you've been.
It comes down to that social distancing, too. If 50 people in a small room, you're going to be within inches of each other. 50 people in an acre outdoors, you can separate that 6 feet. But, again, you can have 5 people in a small room and they're close together. You can have 5 people outdoors.
The thing that's maddening, I think, for a lot of, I'm sure for you guys, is looking at the scenes of people on the street having beers and partying and saying, oh, who cares, this will pass. I mean, what's your message to the people who aren't listening?
Well, my message is it will pass, but it will pass because we're going to make it pass by helping each other out. And that doesn't mean getting together, getting to these parties and getting close proximity to each other, because even though we always say it affects the elderly, the ones with pre-existing conditions, that doesn't mean it doesn't affect everybody else as well. Somebody else could get it, and we've had younger people die. We've had 30-year-olds die from this. And so this is something that can affect anybody, and we all need to take it seriously.
And to put a fine point on it, what we're trying to do at this point, correct me if I'm wrong, is slow down the virus. The virus is coming. It's going to affect people. The question is how quickly and whether it stresses our healthcare system beyond its capacity. If it spreads and you get that peak, this is the flattening curve discussion we're always having. If you get that peak and the hospitals are overloaded, it's not just coronavirus people who are affected and might not get treatment. It's other kinds of serious things. So it does affect you if you're home.
If you look at ICUs, we have about 50,000 ICU beds. Most of those are full already without coronavirus patients, just with everyday patients. And so if you stress the system with more, and that's what we're talking about, flattening the curve, coronavirus is here. It's not going away. We need to get it under control.
Dr. Fair, just fast forward a week, 2 weeks. What do you expect, given the trajectory that we're on, what do you expect things to look like?
It's just an expectation, but I would say that we will approach Italy, Spain, France, and we are going to eventually have to implement, if it continues the way it is, with people not taking it seriously. Because if everyone is not on the same page, if you have half the people that are out at bars and restaurants and partying, half the people are not, it's not going to work.
Well, you're saying, so, I mean, when you look at Italy, and some people will tell you, oh, we're about a week or two behind what Italy is seeing now.
Yes.
I think Italy had its deadliest day yesterday ever.
Yes.
But, I mean, is there still time for us to avoid that fate?
I don't know if there's time to avoid that fate, but there is still time, and there's no choice, frankly, that we start now. And frankly, I would advocate that, we take a week to plan it, because there's going to be a very large safety net for. There has to be a plan 14-day shutdown of all non-essential services across the country, because again, if we don't do that everywhere, it's going to just keep popping up in different hotspots.
Remember now, the measures are taken now. We're not going to know if they're going to work until 5 to 14 days from now, because that's when the incubation period is.
Well, the problem with this whole thing is we've been waiting for this, and we've been talking about this. The tests are coming. The tests are coming. The tests are here. The tests are here. Like, where are the tests?
Are the tests here?
Are they here?
Has it gotten better?
We saw the press conference yesterday, and they said the tests are here. 1.9 million tests this week. There's going to be more tests following that. They're opening.
By the way, we heard that last week. I've been hearing that for 10 days.
That's the story. And what I'm hearing from people that I know that are working on the front line, they're frustrated because they're still trying to get the tests. Lines are long for trying these drive-thrus that have tests, and so hopefully we're making a turn here and getting those tests, because that's the linchpin of all this. Without those tests, we don't know where these outbreaks are. We don't know where these infections are.
So, first of all, it's great that we've finally engaged the commercial sector to get tests out. That should have been done in the beginning, but not to point fingers and think about the past. Going forward, though, we have other facilities that we've stood up across the nation. DOD, the BARDA, which is a specific agency that deals with this type of thing, specifically created to deal with pandemics, in fact. Every manufacturing facility across the university systems, across anything that's pharma grade that can produce the same test, because, this is past the time of patents and worrying about how much money you're going to make. So distribute the formula to everyone, have it made at every single facility, and that's a whole of government and a whole of commercial sector response, and that's what we have to have.
All right, docs, we're going to be talking with you a lot, probably later today and certainly in the coming days. Thank you. Stay healthy. We appreciate it. Let's talk more about this sweeping plan to slow the economic fallout of the coronavirus. Another big part of this story, as we mentioned, the Federal Reserve, cut interest rates to near zero. So what will that do? What's the theory behind that? How will Wall Street respond today? NBC senior business correspondent Stephanie Ruhle joins us with more on that. Stephanie, let's just start right there. And for those of us who are not as educated on the financial system as you are, when the Federal Reserve cuts rates like that, what is it trying to do? And is there any evidence that it will work in this situation?
All right. Well, let's go big picture to small. It wasn't just our Federal Reserve. It was central banks around the world cutting rates. That means they are making it cheaper for big business, small business, and individuals to borrow money, making it easier for banks to lend money. What that tells all of us is that the economic impact of the coronavirus is going to be crippling. You were just talking about it there. When you see cancellations, shutting down, and isolation, if you have any sort of consumer-facing business, it costs the same to run your business, but your revenues are about to go to zero. So now that the Fed is making it much cheaper to borrow money, hopefully those businesses can stay afloat and not have to lay off workers.
So the idea is just borrow a bunch of money. It's not going to cost you to borrow that money, kind of like a Band-Aid to tide you over for these businesses?
That's absolutely the case. Now, in normal times, when the Federal Reserve cuts rates, the idea is let's make it cheaper to borrow so people can go out and buy a house, refinance their mortgage, maybe build something. That's not what's happening here. This is an emergency rate cut really designed to help people stay afloat.
Okay, and real quickly, now I remember during the financial crisis, there were measures taken with complicated names but basically it meant to keep the financial system afloat, to keep the banks have credit, to have cash, to be able to keep almost like the arteries and blood vessels of the financial system going. Is there any need to do that? Are there any actions being taken to that end?
Okay, so I think what you're talking about are bailouts and rescue packages. Now, what we just saw from the Fed is monetary policy to help with lending, to keep things afloat and to make it easier for banks. As far as bailouts for certain industries, we could see them. You just heard Miguel talking about travel, leisure, airlines. Those industries are suffering and they could seek government support. But I just want to share what's really important for individuals out there who are saying, I just got my shifts cut. I'm a personal trainer and my gym is going to be shut for the next 8 weeks. Who's helping me? Well, I want you to go to your individual state website, and then you can look up unemployment, because state by state, we're seeing unemployment benefits change. Ohio yesterday just changed, so companies that are temporary, industries that are temporarily shut, people that are quarantined, can apply for unemployment benefits. Now, these things are changing daily, so I urge people, if you run a small business, go to SBA.gov, that's the Small Business Association, or check out unemployment benefits. In a time like this, we're seeing changes made to help individuals.
Okay, I want you to stay on top of that one for sure, Stephanie. We'll be back with you as we keep on top of those rules. Before we go further, a personal note for this show. Last night, we learned that a colleague of ours on the third hour of today has tested positive for COVID-19, the novel coronavirus. So out of an abundance of caution, Craig and Al have taken the morning off so we can trace their contacts, see what's going on with them. We promise to keep you posted. Both are fine right now. They feel good.
Yeah, they said they feel great.
But caution is the order of the day.
I think, we're just trying to play exactly by the rules, and we hope and wish that they come back.